Everyone, Dr. Rich Castellano, the Smile Doctor, here today with Eunice. How are you feeling, Eunice?
Good.
Very good. Eunice has had her relaxing medicine. We're going to be doing a mid-lift procedure for her. The neck and jawline is where we are focused on improving. And we did her sculpture, which went very well for her. And now my team has everything set up perfectly for us. So I'm going to zoom in here. And Eunice, I'm curious, what was it that inspired you to have a cosmetic treatment done?
I just wanted to look a little younger and less tired.
Got it. And you are a former OR nurse, correct?
Well, I'm a former kind of everything nurse.
Okay, good, right?
I was a scanner.
Now, how did you find us originally?
One of the seminars.
Very good. Was that helpful at our seminar where you could talk to people that had it done?
Yeah.
So we got our seminar coming up. Is it either Wednesday or Thursday?
Wednesday.
Wednesday. Tomorrow?
Citrus Hills.
Citrus Hills. If you're out there at Citrus Hills, we'd love to see you, or come by. We have the most fun at our seminar, so come by and see us. And what I'm going to start doing is I'm going to do some of the numbing medicine here. And I've got all gowned up here. A little gentle there. Okay, so now, let me do this little double tie here. Got my little extra double tie here. Okay, now, this is a little bit of the numbing medicine, so you feel pinch on 3, 1, 2, 3, pinch. You feel small, medium, big pinch, not too bad.
Just a little.
What was that, small, medium, big?
Small.
Small, okay. If you need a break, you let me know. I'm not in a hurry. So just a little bit of lidocaine. This is where we'll do a few little stitches under the chin. Eunice, did you have a chance to look through our book?
Yes.
Was that helpful?
Yes.
Okay, good. And this is a little bit of tumescent. Do you feel small, medium, big pinch here? Not too bad?
Small.
So you can download our book. It's on Amazon, on Kindle. We guarantee we can make you look younger. Little pressure, little pinch there. This tumescent solution for the physicians and students that are watching, made up of lactated ringers, bicarbonate, lidocaine, and a little bit of the epinephrine, which causes the blood vessels to vasoconstrict. Everything's looking good. Little pressure, little pinch here. You feel small, medium, big pinch there?
A little bit bigger, but not much.
We'll go slowly. And very quickly, we'll have the whole area numb. People tell us it is harder to watch the video than actually have the treatment done. So it's easier to actually do it. Because all Eunice has to do is just relax, and she'll feel some pinches, but after I'm done with the numbing, she is not going to feel anything. She won't know what we're doing. And some patients fall asleep. We wake them up when they're done. But a lot of people are unaware that you can do facelifts under local anesthesia. Thank you for watching. Thank you for sharing. If you're just joining, I'm Dr. Rich Castellano, double board certified facial, plastic, and reconstructive surgeon. How about here? Small pressure, small pinch?
Medium.
Medium. Okay, she's feeling medium. So we'll go slowly. We'll let that settle in. Can you feel that getting a little bit more numb there?
Oh, yeah.
Everything's looking good. Thank you for watching. Thank you for sharing. Hi, Wendy. Hello, Lisa. Thank you for watching. How about here? Pressure pinch? Everything's looking good. We're in Tampa and the Villages, Florida. We're on a mission to stop bad plastic surgery. Feel a little pressure pinch there?
Yeah.
How about here? Small, medium, big?
Small.
Very good. Hello, Sandy. Hello, Maria. Thanks for watching. Good afternoon. Little pressure, little pinch. Patients today, they want to avoid general anesthesia. They don't want to have a breathing tube. They don't want to go under. So this is, you'll feel very comfortable. Hi, Judith. And it's definitely much safer. Patients are worried about anesthesia risks or risk with dementia with anesthesia, and it's just not necessary to have general anesthesia when you can do it like this. Very good. We will be rebroadcasting, so make sure you are following. You feel a little pressure pinch here or not too bad? Small, medium, big?
Nothing.
Thank goodness for lidocaine. Now, did you do your nursing work here in Florida?
No, Georgia, North Carolina, Virginia. My husband was in the military, and we both worked for VA
Very good.
and for other, for university medical centers.
Okay, so you must have a lot of interesting stories to tell.
Oh yeah, public health too.
Hello, Bruno. Thanks for watching. Thank you for sharing. I'm going to turn your head this way now, nice and easy. Just leave it alone, please, darling. Everything's looking good. Hello, Joanne. Thank you for watching. Thank you for sharing. Make sure you're following us and you get our alerts because we will have more broadcasts. We're on a mission to stop bad plastic surgery. We're here to help people raise their standards and do things the right way. Perfect. You feel a little pressure pinch here?
Yeah, a little bit.
A little bit more there.
Yeah,
A little numbing.
that's the worst one yet.
Right. And we're going to turn this way. And a little bit more. Turn, turn, turn. There we go. Post-auricular. This is subcutaneous. Tumescent anesthesia helps to elevate the skin. Also helps with hemostasis, reduce the bleeding. Perfect. There's physical versus social downtime after the lift. Physically, we'll get back into our routine, errands, shopping, things around the house within a day or two. You feel pressure pinch here?
Yeah.
Socially, we pass the grocery store test 7 to 10 days. You walk into the grocery, nobody really does a double take. Everything's looking good. Pressure pinch. Give us a call if you're interested in pricing and you want to know what's right for you. It doesn't make sense to just give a price because you need a plan. So you can go to imagelift.com/pricing and put your wish list in, but still you need a plan. What's right for you? That's where we do the one-on-one consultation, face-to-face or virtually. Okay, let me turn your head this way now. 27, please. So now I use a little bit of local anesthesia. You feel a little pinching here. And then I'm going to do some numbing medicine across the incision line. Let me turn your head this way now. Very good. So we use a hair-sparing incision. And so this year is the big year. Is 70 this year?
Yep.
That is amazing. What a great milestone. Congratulations.
December the 26th.
December 26th. So proud of Eunice, taking great care of herself. She has many active years ahead of her. And it's an honor to be a part of her lift experience and give her the best results we can. Let me turn your head this way just a little bit and turn just a little bit more. Perfect. Local, please. You can set that down because I'll ask you to just turn on the laser. No, I'm not put that back on. When you turn on the laser, please. So a little bit of numbing here. We're going to be using the laser lipolysis. Thank you for watching. Thank you for sharing. Low pressure pinch. Eunice, I'm going to put these little eye shields over top, okay? Your job is just to keep your eyes closed, number one. Number two, the eye shields protect you. I'm going to turn your head this way and chin all the way up. Number three, we only activate that laser when it's in a safe place to do so. So you'll feel pressure. If you feel any pinching at all, you let me know, okay? Very good. So now, we use the laser lipolysis. So that's the helium neon beam there, and that's going to break up fat, and it's going to keep the undersurface of the skin. So that way it causes a little bit of contracture. As we age, we lose the elasticity in our skin, like the elastic band gets stretched. So this will work hand in hand with tightening of the muscles that we're going to be performing with the modified smash plication lift. Everything's looking good. If you feel any pinching, Eunice, you let me know, okay?
Because it's just pressure.
Hello, Adrian. Hello, Bonnie. Thanks for watching. Thank you all for sharing.
Will I be able to see the video?
Yeah, you can watch your video. Are you going to watch your own video?
Yeah.
Yeah, you can watch it. Say hi to Eunice. Eunice will be watching. We got it on YouTube and Facebook. And thank you for your comments and questions. We're here to make sure you got your questions answered. Some of you are DMing privately. That's fine. We'll answer those. Very good. Perfect. So this elevates the skin, breaks up some of the fat, and creates that thermal injury under the skin that helps us to tighten and firm and make up for that loss of elasticity, in addition to working with the muscle tightening, the smash layer tightening that we're going to be doing here in just a few moments. I measure the amount of laser energy I deliver by the joules I see on the machine, by the time I know that I'm doing it, by the temperature that we monitor externally, and by the temperature I monitor with my hand, our MEC. Everything's looking good. Thank you for watching. Thank you for sharing. We will be rebroadcasting later. Hello, Deborah. Hello, Maria. Hello, Cheryl. We're doing a local anesthesia facelift. There's physical versus social downtime with the lift. Hello, Ann. Physically, we get back into our routine within a day or two, errands, shopping, things around the house. Socially, we pass the grocery store test 7 to 10 days. You walk into the grocery store, nobody really does a double take, but we're wearing masks, so it's sooner now. And we always need to talk about our ABCs of plastic surgery, because when you know the ABCs of plastic surgery, you'll make your best choices because you understand the bigger picture. So ABCs, A stands for area. There's 4 areas we address to improve the facial appearance. If we sag, we tighten. That's what we're doing today. If we lose volume, we fill, and we did do some of that sculpture today. Sun damage, wrinkles, and sunspots on the skin, we can polish and repair the skin. The 4th area is better than everything else. That's our behavior. Nothing looks as good as Mother Nature's free facelift when we smile. The smile always looks the best. Little pinch there. How about now? You feel any pinching? Okay, good. Hello, Angela. Good to see you. Thank you for watching. Thank you for sharing. Everything's looking good. With this type of laser, the Nd:YAG laser, we use special goggles to protect our eyes, although we're constantly keeping the laser covered so we're not exposing ourselves. But just as a precaution, we take many laser precautions. Everything's looking good. Perfect. So, 4 areas. B, ABCs of plastic surgery. B stands for boundaries. What are the rules for good plastic surgery? Safety is always first. You must look natural. Let's prevent future aging and let's get as much improvement as possible. We can't make things perfect. We're not God. We do the best we can. And if we need to come back another day and do more, it's better than going too far. That's C for boundary. C stands for combination. If we want our best results, we combine tightening, volume, skin. Best results with just one treatment is lift. Best results no downtime. Filler. Fillers do a great job. They don't give us a lift. And lifting, we get wonderful results, but I can do better when I combine. So that's C for combination. D stands for different perspectives. We never see ourselves the same way that others see us, which is very interesting. Because even though we're looking at the same thing, we do not see it the same way. Because when we look at other people, we look at them socially. But when we look at ourselves in the mirror, we do not look socially. We look seriously. We look for imperfections. Hello, Teresa. Thanks for watching. Thank you for sharing. Everything's looking good. Perfect. Temperature, please. So I'm particularly focused on contouring the jawline and even elevating the skin, pre-auricular and post-auricular. Ari's monitoring the temperature, and I'm monitoring the temperature with my fingers. I'm monitoring the jewels we get from the laser. This is the Cynosure Triplex Nd:YAG laser, the smart lipo device. You feel any pinching there? Eunice, do you feel a little pain there? Okay, good.
I just swallowed.
Okay. I'm watching. If Eunice moves, I see her, so I say, is everything okay? That's the best way to monitor patients, is just, they're awake. You ask them how they're doing. You monitor oxygen, we monitor heart rate, we monitor blood pressure, but more important to monitor the patient. You know, how you feeling? How you doing? Perfect. Very good. Thank you for watching. Thank you for sharing. Hello, Shahab. We got a little bit of fatty tissue. We're breaking that up, and then I'm going to trim that as well. I do liposculpting. You can cough, we're wearing masks. By the way, we wear our PAPRs, which are 3M HEPA filters. You doing okay?
Yeah, just need to clear my throat.
Everything's looking good. And this protects our patients. I've had the vaccine. And Eunice has also had the vaccine, the first dose, which there's no contraindication for the vaccine with any of our treatments. There were 3 patients reported that, not my patients, but they reported to have some swelling after the vaccine, but then it went away after antihistamine and steroid treatment. So I've had none of my patients have a problem with the vaccine. Okay, so we're done with the laser. So now what we're going to do is I'm going to use the Hans Facelift scissors and the brown acid, and we are going to elevate under the skin. Hello, Nene. Thanks for watching. So, right there. You feeling me right there? Everything's looking good. And Ari has everything set up perfectly. Eunice, how you feeling, dear?
Good.
So just elevating. It's much easier to elevate now that we've done the laser. Perfect. The laser also helps with hemostasis, little cauterization of the vessels. Perfect. Everything is looking good.
What was that crunching? Was that breaking up the fat?
Yes, that was what the laser does. And she says you feel some of the crunching. That's the connective tissue that the laser breaks through as we're manually putting that fiber optic into position. Right now an outfit, please. Very good. Everything's looking good. So I'm just directly sculpting the fatty tissue that's right on top of the platysmal muscle. We stay above the platysmal muscle because that protects you from nerves below. Some doctors will remove muscles and glands in the neck to sculpt, which I think gets a little aggressive. I don't think that that's necessary to get a good result. And patients today, they want to look natural. They don't want to look too extreme or too overdone. Very good. I use the gauze to give you better visualization. So if there's a little fluid, as you can see, there's almost no significant bleeding here. Coming away from the fatty tissue and then elevating across that inferior border of the mandibular angle, the inferior border of the mandible that I should say. So now I'm going to do a little bit of stitching. This is the Puro Esteban. Thanks for watching, Candy. Thank you for watching, Supawan. So, there you go, Puro Esteban. Alright, for the physicians and students that are watching. You'll feel it get tight underneath here, Eunice, okay? You doing alright? Hello, thank you for watching, thank you for sharing. This is a corset platysmoplasty, where we are tightening the platysmal muscle. I'm going to trim just a little bit of the fatty tissue. So for visualization, I'm going to put a little gauze there. Thank you for watching. Thanks for sharing. Hello, Margie. Hello, Michelle. Thank you for your comments and questions. We're in Tampa and the Villages, Florida. Just a little bit more. Eunice, are you feeling any discomfort at all?
No.
You'll feel it get tight.
Little tightness.
Tight is good. I have my patients wear a wrap for 3 to 4 days around the clock. We'll do all the wound care tomorrow. My nurse Caitlin's going to go through that, and I'm going to instruct Eunice on what she needs to do tonight. Here's the little spoiler alert. The sneak peek is that tonight Eunice's job is to stay hydrated, drink plenty of fluids, that she has to go to the restroom every couple of hours. Number one. Number two, keep her head elevated. Not sitting straight upright, but just up enough that you reduce the swelling, but you can still lay back and rest comfortably. And number three, we like to check to see every 2 to 3 hours do we need a pain pill. If we sleep for 6 or 8 hours in a row, you don't want to get behind in the pain medicine. It's not the end of the world. We just prefer to avoid that. Everything's looking good. Hello, Jacques. Thanks for watching. You want me to itch your nose there?
Yep, the nose itches.
On the top or bottom?
Right there.
Did I get it for you?
Those good.
Okay. You're a captive audience. If you need me to itch again, you let me know, okay? But this all looks really good. Other side for me, please. Will you totally please? So right now we have a really great contour through here, and I'm going to contour a little more when I tighten in through this area. I'm going to elevate a little bit through here, and then I'm just going to do an exposure for me, please, and a little bit of contouring under on this side. Once I've done the platysmoplasty, it gives me a little more exposure, makes it easier to see everything that I need to do. And again, we're staying above the level of the platysma to stay away from deeper structures. Perfect. I've done over 4,000 facelifts under local anesthesia. You get the hang of it after a few thousand. Will you totally please? There we go. So just a little bit more contouring. I'm going to turn your head this way now, nice and easy. Is that okay for you like that? Okay, very good. So right now, we're just going to, now that you see her neck and jawline there, we're going to start on her other side, but you can see what a nice improvement where we've started her jawline here, much, much sharper. Thank you all for watching. We're going to be starting the next very soon. We'll be back.